Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Have you ever heard of a small muscle called the piriformis? If so, you know it's the big mover of your hip. If not, I'm going to share more about the piriformis with you right now. There are a lot of reasons for back and hip pain, and you really have to know which is which if you're going to get the appropriate treatment. But back pain can be caused from a degenerative joint, from muscle tightness, from poor ab and core strength, from trauma. All these reasons can cause back and hip pain. But one of the main ones that often people don't think about is something called piriformis syndrome. Now, anything that has the word syndrome behind it has typically 3 symptoms associated. And with piriformis syndrome, what we'll often see that includes that is restricted motion, pain in the hip area, the back of the glutes and the hip into the actual hip joint, and oftentimes radiation from that spot of the hip somewhere down the leg. But with piriformis syndrome, it's important to know that oftentimes while there may be like a structural issue of the spine or pelvis that's not moving right, that's allowing the piriformis to get irritated, if we can get to the source, the piriformis, and we can get that muscle to relax, lengthen, and then be properly rehabbed, it does a wonder for that specific type of lower back and hip pain. So a little bit more about the piriformis muscle. It's not a big muscle. It's really, really important that we take our piriformis muscle as it is going to contract. It's going to help the glutes the glutes contract, and even in some hip rotation. So by all of us understanding that this little muscle has a big, big impact, it gives us more importance on exactly how to treat it. So with piriformis syndrome, the first thing that your providers might do with piriformis syndrome is they're going to take your muscle and they're going to try to just kind of work it through. Oftentimes you're laying on your stomach, they'll put their thumb right kind of behind your hip on the back side of your glute, and it's just going to wiggle that in and out. That's one way to do that. There's also a lot of ways that we can use electrotherapy, TENS units, things like that to try to get some relief to the piriformis muscle. Additionally, we can use things like acupuncture to try to drive down a needle into the piriformis muscle or close to that area to release it that way. Then, once we find out what we can do, obviously, hopefully we don't have to use things like pain medications and other external things. A lot of times with good stretching and with good muscle work, we're gonna get that piriformis to calm down. Then it's a matter of strengthening around it. And so we're gonna there's some very specific strengths for piriformis muscle that your providers can show you that revolve around glutes, the glute area, and then also opening of the front side of the hip so that we keep both sides working equally well. Because if that piriformis is tight because there's so much tension on the front side and causing that backside piriformis to get lengthened, that's not going to work for long. So we've got to always look at the entire thing. So looking at the piriformis locally, first by reducing the spasm, reducing some of the tension, and then globally, by saying what else is going on the pelvis on the other side, even on the opposite glute, that's how we're going to get the best results with piriformis. And these providers that work on this, they're specially trained. They do an amazing job on it. So if you have low back pain, whether or not you've been in a trauma situation, and if that back pain seems to be in your hip and or groin, it's a good bet that you could have a piriformis component to that. So get that checked out. Now, of course, if you have any questions, let me know. You can email me, jim@ramoslaw.com. Or you can send an email with anything that you'd like to talk about. So we're here to help. Send this around if you found it helpful. And always remember, from our perspective and from yours, your health matters.